Up.
program.
Heads Up
Okay.
is the program.
Okay.
And you guys can take it too.
Okay.
So, and there's different levels to take. I think there's like parents, there's
Yeah,
coaches.
scouts.
Yeah.
When I
Okay.
coached
Did
basketball.
you have to take?
Yeah, I
a
did.
test? Okay.
So each coach had to do a little program, and there is protocols. You're supposed to examine them quickly.
Right.
And then if there's anything, you obviously pull them, and then there's a whole protocol of when they can come back.
Yeah.
And you have to have doctor's release.
And they should be out of the game, sitting on the bench 24 hours.
Yeah.
Yeah.
They don't go back, which is often 2 days if you think about a nighttime game, right? But that's when in doubt, or even you suspect, out. Just sit it out.
Out, and then, I mean, as a parent, I would be taking them in to be assessed.
Yeah.
You know, just, cause I just feel like
Yeah.
that's the most important part of your body, you know?
Mm-hmm.
Not
Yeah.
that, we're not gonna go very far.
We
Yeah.
should teach some other parents that.
Yeah.
Right?
No.
Yeah.
Clearly, you're the parent who cares.
Yeah, because once they're pulled, they're supposed to have the doc's note to come back. That's
Okay.
kind of it's the law.
Yeah.
You can't be allowed back to play without.
Well, and we'll be doing the football in Missoula.
Mhm.
So the Missoula Football Association is a
Good.
good for kids. And I think it states on there that all the coaches take a
Good. They
course
should.
and all of
Yeah.
that, so
Yeah.
we're supposed to.
Yeah, exactly.
Oh, and I'll ask my coach. I'll
Well,
ask my
yeah,
coach.
you
Yeah.
should.
I'm
And
gonna
maybe
be
you're
there.
lucky and they're like a
Yeah.
ski patroller in the winter, or
Right.
they're EMT, or
Well,
you know.
I mean, our coach, he does football, basketball, and baseball.
Yeah.
So I'm sure he's well aware.
Yeah.
But I still, just for someone I wanna know.
Yeah. You just don't need the coach. Oh, I'll get back in there, you'll be fine, kind of thing. That
Yeah,
just
I don't
doesn't
want
fly. So just the last 3 pieces. Second impact syndrome. So this is the kid that got struck yesterday or last week, and he takes a hit today, and within minutes to hours he has mental changes. Okay, that's this second impact syndrome, SIS. It's frightening to watch, one, and it's scary. They need to be assessed immediately. Okay, so that's, I can't remember the rate. What's your percentage more? After your first hit, you're 62% more likely to have more severe symptoms after the second one. Is it
I
something
don't know
like
the
that?
number,
Yeah,
but
some
it's
huge
pretty
percentage.
high.
Yeah.
And that's why we'll be talking about return.
Yes, I
Yeah,
would.
so there's that whole return to play, and there's a reason we do it the way we do it. So,
So, and I think I'm just going to
Yeah,
speak to
go
that for
for
just
it.
a second. But so second impact syndrome, that's how Dylan Steigert passed away, right? So he got a first concussion, same game. He's the athlete. I gotta stay in. He's playing college football out in Oregon, and as the story goes, you know, he doesn't tell anybody. His teammates don't notice. He plays the next play, and boom, he gets smacked again hard, and he dies. So very, very high rate of death if you don't get pulled out and you get struck again hard. So that is where like this law comes from, and why the coaches now in the state of Montana have extra training, and now this extra training across the US and all the states is being passed actually. So it's a big, serious problem. Like nobody needs to die for football or soccer or skiing or whatever it is. And that's why the coach has to have a written note from the physician to clear the athlete back. So
and hopefully
this,
it's a doc that understands the process.
well, that's
right?
the other problem.
Oh, he came in, Bob came, yeah, he's good, send him back. It's
Yeah.
like, did you do any of the stuff that you're supposed to do? Nobody should go right back to full play. I mean, there's this whole process that we'll get into. It's graded and on how they respond and what their symptoms are. It's all the post-concussive syndrome stuff that comes around, which is the next piece actually. Those are the lingering things, right? It's the neck pain, it's the headaches, vertigo, some neuropsychiatric problems, right? You look at the professional players and they've had their bell rung enough, they have CTE, that's a cerebral, oh my God. Just like
Traumatic
encephalopathy. So their brain fails to auto-regulate, and that's the other piece of second impact or second impact syndrome. Your brain is unable to, blood vessels aren't able to auto-regulate, so they swell and they leak, and there's edema in the brain. So that's kind of the whole piece there. Hemorrhage bleeding. That's what I'm talking about.
Yeah.
Bleeding in the brain. So there's a smaller number of athletes who will have bleeding in the brain. It's somewhere in the 1 to 10%, depends upon age and sport. These can be insidious. They take a while to develop if they're not huge. The more severe ones are people who have AV malformations, so the arterial vein, there's malformation up there, we would think of them as an aneurysm or something of that nature. Those are sudden. Right? Those are sudden changes. Subdural bleeds, boy, it's just a headache that will not go away. My neck is killing me, my head's getting worse, I'm acting strangely, I'm not talking clearly, my head still hurts. That's kind of that subdural bleeding. Those are the concerns. That's an ED visit. That's probably a CAT scan. That might be a surgery.
And that's like the unrelenting headache. Like your athlete will say, "This is the worst headache of my entire life."
Those are alarm
Like
bells.
that's like they say that, you're going. So.
And would you prefer those patients go to ED, or is urgent care
ED.
appropriate? So you're saying straight to ED, yeah.
Which is emergency department.
Yeah.
Oh.
Just so you know.
That's not.
I do EMS, and one of the things we focus on too with the head injuries is there's a greater risk of a neck injury.
Absolutely.
And so, and I know not everybody hears in EMS, but that's part of our assessment, and we want to consider the spine. I think they taught it, there was a great analogy, think of the head being a bowling ball and your cervical spine being a pencil. And that head takes a blow, what's going to give? So we're always pretty careful about that. You don't have to, just move them gently. Don't move them a lot. Don't twist the head.
Yeah.
But in anybody I see that has significant signs, loss of consciousness, repetitive, not alert and oriented to person, place, time, event. Their parent can make the decision. But I always recommend they go to the ER. And the thing is, with kids, we're dealing with, they can't refuse care. So
Right.
when you have an adult, it's implied.
It's different.
It's implied though that if they were knocked unconscious, they're not alert and ready person, place, time, event, then they can't make that decision. And so we always err on the side. And I see concussions all year. And most of them are with kids wearing helmets too. So
Yeah, much greater or much less chance of concussions with helmets.
yeah, and I can only imagine what they would have been like if they had to wear that helmet.
Right?
Yeah.
Yeah, devastating traumas.
Yeah, exactly. Probably did. So yeah. Okay, cool. So I'm gonna kind of do a little intro to recovery from a concussion. So it's very, very important if an athlete sustains a concussion to follow the there's two different protocols. Return to learn, which is going back to school, because if you sustain a concussion that, can't quite remember, math skills are off, the smart board in school, like it's just causing increased symptoms, there's very specific protocols to follow for school. And then there's also specific protocols to follow for physical activity and getting the athlete back to ready to go to a sport. So Grace will talk about that in a second. And as I said before, it's required by the state of Montana to follow these protocols. And like Todd said, hopefully your primary care, whoever you're choosing to care after your athlete, is actually aware of the return to play protocols and the return to learn. So I'd say most of the primary care in this valley is decent, and when I found a few that weren't, I've taken them out to lunch, so they know all about it. So 93% of athletes with a concussion will complete a full return to learn within 10 days. So you're good to go back to school. So that's pretty good, I think. 1 month is an average for return to play. Okay. Advanced neuroimaging, fluid-based biomarkers, genetic testing, those are all used in the lab setting to know when somebody's recovering from a concussion. However, those tests, they have not made it to the clinical side yet. So don't think that you guys send Todd a concussion and he's going to order some magic test and you're going to be like, oh yeah, there it is on the MRI. We can't tell yet, okay? They're developing all this new research and stuff, hence this big meeting they had in Amsterdam last year. But we don't have access to that. Like maybe University of Montana does, but they're still using lab rats, okay? So that's where baseline concussion testing really, really comes in because there's so many subjective findings, right? Let's see. Yeah, so without further ado, Grace is going to talk about returning.
I will. before I talk about returning to school and sports, I'll just go